The next area that is going to help us to strengthen and stabilize the TMJ joint is the tongue. We don't really think about working out the tongue, what the tongue is doing throughout our day, but strengthen the tongue can really help with coordination and stability in the TMJ joint. So to look at how the tongue moves normally, I'm going to have my patient, I'm just going to say, stick out your tongue and see what they naturally do. One of the most common things that we see is the tongue come out and immediately down, like that, or it's just going to come out, but it's going to rest really strongly on those bottom teeth. That is usually because the tongue isn't strong enough to stay all the way up. Your patient's going to have a lot of difficulty in just holding it without touching those bottom teeth. Everyone should be able to do this. Some people can't. So that is an exercise that I might give on day 1 or day 2, depending on their symptoms. Just sticking their tongue out straight without letting it touch their teeth. And again, I'll have a home exercise program printouts for you to look at in giving your patient to send home. Looking at the tongue, if this is something that you're going to be treating pretty often, sometimes it's beneficial to have tongue depressors in the clinic with you, especially for these tongue exercises, because not everybody wants to touch their tongue, and you don't want to give away all the gloves that you have. So I don't have any gloves right now, so I will do it without. At home, I'm going to have my patients using a toothbrush, because I want them performing these exercises 2 times a day, so in the morning and the night when they brush their teeth, and then they already have that mirror in front of them to use as feedback. So with tongue isometrics, once we have the tongue stick out down and it looks good, then we will add in elevation of the tongue. Where I'm pushing against my tongue and trying to keep my tongue pretty level. And then I will also do lateral protrusion of the tongue. So I'm going to stick it out, and then I'm going to push it on this side. What I don't see and what you can kind of see in the video is that my tongue automatically tries to go and meet my finger. I don't want that. I really want it to be able to stay in midline and be able to control it from there. So I'm going to stick out my tongue. And really focus on keeping it in midline. If that's really difficult for a patient, again, decrease the force that you're using to push with your finger to get that small muscle control, and then we can build into bigger ones.